Good. Good. Hey everybody, it's Dr. Tyler and Dr. Tiffany at Sioux Chiropractic, and today we're going to work on my wife, Dr. Tiffany. So tell us a little bit about what's going on and what we're going to work on today.
Okay, so let's see, it was probably about 7 days ago. We were traveling, and as you guys know, kids don't sleep like they usually do when we're in a different setting. So we had our 3-year-old in bed with us, and I slept kind of with her like in the crook of my arm. I'm assuming like this because I woke up the next day totally locked. I couldn't move my head, and then continued to sleep on a different mattress and on and off with our 3-year-old for a few more days, and then drove home back here to Iowa from Kansas City. So just a lot of upper back, a lot of neck tightness. It's definitely gotten better. I've been adjusted a couple times. I literally couldn't even like lift my head off the pillow. And then obviously with sleeping like that, I have a lot of tightness in this front of my shoulder, and then also off into my deltoid a little bit too.
So we've been doing some treatments on her since we got back, and even while we were down there, and it is getting better. But we're going to go through our evaluation that we do on all our patients at the beginning of a treatment on that particular day. So I'll have you stand up first and we'll check your range of motion.
Okay.
We'll start with just turning your neck, and we'll keep your feet together and go ahead and turn your neck left and right.
Okay. And that pulls down by my left shoulder blade.
Down to the left shoulder blade and to the right. That's harder, huh?
Harder, left and right shoulder blades. Okay. A little bit, just my lower cervicals, that upper trap.
Go ahead and face the wall behind you, and then I want you to do full spine rotation. So twist to your right as far as you can. Pretty good there, and to the left.
Oof.
That's harder.
Yeah, that left
Painful.
shoulder blade. Mm-hmm.
Okay, and then we'll check shoulder mobility by having you take your right hand and touch the left shoulder blade from above. And do the opposite. Anything pinching?
Yeah, that pinch is pretty good.
On that left side?
Yeah, all in this glenohumeral.
Okay, now we're going to reach underneath and touch the bottom of the opposite shoulder. And the other one.
Just tight. So
we're getting a lot of restriction on this left side. Seems to be, consistent with what she's been complaining of. Potentially some discogenic pain going into the scapular area, but she's got a little rounding in the shoulder, so that could also be contributing to some shoulder joint pain. Now I'm going to have you turn to your right, neck out, look up at the ceiling, high as you can. How's that feel?
Just tight in my upper traps on both sides.
And then try to touch your chin to your sternum.
Oh.
Pretty tough to do.
Just tight the whole way. Yeah, from base of my skull all the way down to my shoulder blades.
Okay. All right. Now let's go ahead and look down at your toes. Flex your spine so you go down and touch your toes. And come back up. Give yourself enough room. Take a step or two forward, and then you're going to reach above your head. Look up and arch back. What are you getting there?
Just a little bit of jamming in my SI joints.
A little bit in the SI joints. And then take one step back. We'll do your squat. And feet together, arms out. Squat as low as you can. No pain with that.
Ooh, left ankle.
Left ankle.
I can usually do that, no problem.
Okay. All right, let's go ahead and have you sit at the end of the table. I'm going to sit behind you. We're going to feel everything. We'll start with our motion palpation exam. So I'm going to be starting in the pelvis. We'll work all the way up the spine, checking for any restrictions. I'll kind of let you guys know what I'm feeling as I go. She tends to have a good amount of SI joint restriction one way or the other, just kind of depending on what she's been doing. And then we'll usually get some L5 restriction. But she is pretty hypermobile as we work our way up into the upper lumbars. Like, I feel like I could push my hand contact through her. It's just so mobile once we get into the TL region. And then as we work our way up into the mid and upper thoracics, I'm starting to feel it on her kind of at that T5, T6 level. And she's holding her daughter a lot. She's rocking her, like she mentioned, falling asleep with her arm up like that. This is all an area of restriction. So I'm going to test that a little further by having you bring your hands behind your head and bring your elbows together, and we're just going to challenge it a little bit more. She's going to lean onto me and just let that relax. You okay?
Oh, it's tight.
And this cervical thoracic junction on her, this is a real common hot spot for patients that are having discogenic pain. And it's one we see that's one of the most restricted regions of the spine where the upper back and the neck meet. And usually the joints down here, they almost move too much once you get in the lower part of the neck, and that's a common area you'll see degeneration on patients as they get older. You'll see that C6, C7, T1 region. That's where you'll see a lot of disc problems because of overuse there. And then we'll see a lack of mobility in that mid-cervical spine. So I'm just going to go through and check that on her next. And that's all very jammed up. There's not a lot of spring, and very tender when I'm rotating her. A little better going left though. And then from about C5 all the way up into C2, she's got notable restrictions. I'm just going to check her occiput a little bit. Is that okay? Mm-hmm. And then when I have patients that are experiencing some radicular symptoms like she's had going into that scapular region or wrapping around in the shoulder or even into the arm, I'm going to go ahead and check cervical retraction. So what I'm going to have her do is just kind of call it double chin it. I'm going to have her tuck her chin back. Are you getting any pain anywhere?
Yeah, that goes immediately to my left scapula border.
Right through here? Mm-hmm. Okay. And then let it go. And then I'm going to have you do that one more time. And that repeated. Mm-hmm. Okay. So we've been doing some McKinsey work with her, which is just basically getting her to end range and extension. And then I'll assist her on some of that. And we'll do that before we adjust her. And I'll kind of show you what that looks like. But we're going to start with just kind of loosening her up. These upper traps, the levator scapular muscles, the suboccipitals. When we're dealing with any discogenic pain or spasm or torticollis, these muscles are very guarded, and it's important that we try to get those to relax before we go in and try to do a manipulation, or it can be very uncomfortable. So I'm going to start with just doing a little release over all these muscles, and then we'll do a little McKinsey on her, and then we'll finish up with a manipulation, and then usually at the end of that, we'll go forward and do some class 4 deep tissue laser, which is going to just help calm that area down, get the inflammation out of there, allow that healing process at the cellular level to continue on after we've done our hands-on treatment. So it's okay with you, honey. I'm going to go ahead and just stretch this, and we'll start on the right, and then we'll go to the left. Okay. And you can actually face here. Go through here, and we're just going to kind of shrug the shoulder up and reach down to your left hip. Look down to your left hip as much as you can, and then come back up. You okay? Yeah,
it's crazy. I feel it on the left with all of this.
Yeah, and probably feeling it on the left just because you're closing down the joint on the left.
It feels, I mean, it's definitely tight on that side too.
We see this a lot with young moms in our office when...
I'm a young mom.
She's a young mom. I'll try to stay appropriate. When you're holding a little one, and our daughter is, how much does she weigh now?
32. She went to the doctor today.
She's 32 pounds, fresh off of her exam today, and she's all 32 pounds. She acts more like 60 pounds, and anyway, kids are wiggling around, they're heavier, you're holding them in front all the time, you're usually looking down. That's a recipe to start having some issues in this neck and upper back region, and it's one of the most common things we see in young moms in our office. So we do our hands-on treatments, we do incorporate a lot of rehab with these patients, and then the class 4 laser just really helps speed up that whole healing process.
It helps with pain so much.
Yeah, we see it quite often. I mean, we can reduce pain by several points just on that first treatment. And it makes it more tolerable when they go home and they're going back to being a mom and holding that kiddo over and over again. We want to keep things as comfortable as we can while things are healing. So now I'm just going back over into the left side, working these rotators in the neck and these erector muscles. This, I wouldn't have been able to do this on her a few days ago. It was very guarded. She's not kidding. Like, it was hard for her to, like, when she was laying on her back, very hard for her to even hold her head up. And that's another common symptom we'll see with cervical disc patients, is they feel like they gotta hold their head or need assistance holding their head up. And that was definitely the case for her, but she's made notable improvement every day that we've been working on this the last 3 or 4 days, and she was able to come and work all week and still do her other full-time job at home, take care of our kids and running them around where they needed to be. Oh. That's pretty tight here. One more. All right, you can go ahead and relax there. Mm-hmm. Next, we're going to do a little bit of the McKinsey retractions and extensions. So, honey, what I want you to do is bring your feet up here, and then we're going to get your shoulders right on the end of the table. So, just let this all relax, and we're going to start by, we're just going to get her depressed here, and then I'm going to apply a little bit of traction on her. Is that okay? Mm-hmm. So we got her back into retraction, and then I'm going to just slowly bring her into extension. Is that okay? Mm-hmm.
So much easier than a couple of days ago.
I got you. You just let her relax right through here. I was getting about 50% as far as 50% less distance on her the other day compared to where we are now. What are you feeling as I'm doing this?
Nothing, it feels good.
Very gentle. We're just letting gravity help us out here. I'm just trying to keep her chin tucked into cervical retraction. And then we're applying that extension into the cervical spine. On these last couple, I'm going to apply a little bit of rotation to it. Go left first. Let me do it. Okay. Mm-hmm. Good. I'm going to support you here, but I want you to go ahead and come back up, and then we'll go on to the opposite end of the table. There we go. Is that okay?
Great.
I'm going to work the suboccipital region a little bit with her before I manipulate. And you just tell me if that's too much. Is that okay? Mm-hmm. Perfect. These are way less guarded on her today. They're like ropes 2 days ago. Good. All right, so I'm gonna go ahead and adjust the neck first, and then we'll flip you on your stomach. She does a lot better when I do prone thoracic adjusting. So after I adjust your neck, I'll have you take your mic off, and then we'll put that on your back. Okay. So I'm gonna go right to the mid-cervical spine, and you just relax, honey. It's already going. There we go. Right through here. And I'm going to be a little lower. Good. All right. So we found that upper thoracic spine was most restricted on her. So I'm going to go just right through there, apply a little traction, and take a deep breath in and let it go. Nice. And a little higher up, honey. Nice. All right, now I want you to just slide down a tad bit and put your hands kind of by your hips. There we go. And then we're going to be in this cervical thoracic junction here. So Apply a little traction there. Deep breath, let it out. Good. Other side. Good. There we go. And then go ahead and then just lift your head up, hold your breath. Good. Right through there. A little bit in that right SI joint, so I'm going to go ahead and clear that out. Other way. And then bring this hip forward. You got it. Right through there. Good. Okay, come on up. And yeah, let's check out that ankle. Get that here. This left. A little bit of restriction there. Let that go. And midfoot. Feel okay? Mm-hmm. Perfect. All right, let's recheck motion. I'm going to have you stand up, and then while you're facing her, let's go ahead and look up, down, left, and right.
It's so much better.
Good. And then let's go ahead and flex whole spine down, touch your toes. Come back up, and then go backwards. Good. Do your squat. Back up. And then go ahead and face this way. We'll do a full rotation of the spine each direction. Left. Good. And then shoulders. Other way.
That?
Yep. And then the left.
It's better. It's tinging in there, but not like, it's not like restrictive like it was. I can like actually like do that.
Good. Cool. How's that feel going right and left?
Right, left.
A little bit to...
Way better.
Yeah.
Like it's not as sharp and it's not radiating.
Nothing into the shoulder?
None of it's going into my shoulder anymore. It's all just...
So we centralized it to the neck. Good.
Mm-hmm.
So she's going to continue to do her retraction exercises at home. It's important that we try to get that out of the arm first. And our first goal is to centralize that pain. So that, to me, it looks like it was an effective treatment. It's localized to just the neck. She's still got a little bit of pain there. We're going to continue working on it throughout the weekend. She's going to do some laser here next and continue to do her rehab at home. And yeah, I will be seeing her in the next day, next hour. And yeah, thanks for watching. If you enjoyed our content today, we encourage you to like and subscribe to our YouTube channel. And we look forward to showing you more videos soon.